Hi everybody. Okay, today we're here for another video, and my assistant, as you can see, Bruno, my assistant's here. Bruno, what are we going to talk about today? You want to talk about how ketogenic diets affect exercise? Do you like ketogenic diets? No. Oh, okay. Well, everybody has their own opinion, right? All right, let's talk about ketogenic diets. What is a ketogenic diet? A ketogenic diet is a very low intake of carbohydrates. Usually it's 25 grams or less, depending on which source you look at. Some of them talk about ketogenic diets being as high as 50 grams a day, but usually it's like 25 grams. Sometimes it's actually no carbohydrate whatsoever. Ketogenic diets were reviled years ago. There was a Robert Atkins, popularized, well, he wasn't the first, the ketogenic low carbohydrate diets that have been around for. There was a book published by William Banning back in the 1860s. So low carbohydrate diets have come and go over the years, but the ketogenic diet, you could look at that as the ultra low carbohydrate diet, really low. In the 20s, they found that giving children with epilepsy a ketogenic diet dramatically improved the frequency of convulsions in children, because it has to do with ketones, which are at the heart of ketogenic diets. And that, of course, is where the ketogenic diets derive their name from. Ketones are incomplete byproducts of fat metabolism. They're basically metabolic acids, and what they found is that the body can use ketones as a fuel instead of glucose in most tissues, with the exception of certain nervous system components. I believe the retina of the eye. But however, ketones are actually a superior form of fuel for the brain. The brain normally works on glucose. It's a glucose hog. I think about a quarter of the sugar you eat or glucose in your body each day is used to power the brain. However, what they found is ketones can actually be used more efficiently by the brain than even glucose. There's some emerging information indicating that people in early stages of Alzheimer's disease who cannot properly utilize glucose because of the disease process, if you give them sources that produce ketones, for example, medium chain triglycerides, coconut oil, both of those things produce greater amounts of ketones in the body. What happens is you give it to the people in the early stages of Alzheimer's, and it seems to greatly improve their cognitive or thinking ability. So the thing is that, as I said, that's how the ketogenic diet started. Basically, for medical use as a treatment for epilepsy, mainly in children. It's still used for that, by the way. Then of course, athletes started using it for years ago. Vince Caranda, famous trainer in California, used to recommend ketogenic diets. A couple of examples. Dan Duchaine wrote a book called The Body Opus Diet. Dan Duchaine was around years ago. He's often referred to as the steroid guru. I knew the guy. Nice guy, but a little bit of a strange character. But anyway, very smart guy. He wrote a book called The Body Opus Diet, which was directed at people who wanted to get their body fat level to 5% or below, which is, of course, shredded. That's shredded. And the diet he recommended was basically a ketogenic diet, just like I described, 25 grams of carbohydrate or less, plus he added carbohydrates on weekends. Similar diet was espoused by Dr. Mauro Di Pasquale, MD, Canadian physician, old friend of mine. He came out with the anabolic diet, which also basically worked as a ketogenic diet about 5 days a week, carbohydrates on weekend. Mauro pointed out that when you followed the ketogenic diet, the low carbohydrate component maximized, and because of the high fat aspect, the ketogenic diets are low in carbohydrate, but usually much higher in fat, sometimes as high as 70% fat. Anyway, Dr. Pasquale pointed out that the high fat content of the diet would tend to stimulate testosterone production, whereas the low carbohydrate content would maximize growth hormone release. And then on weekends, you'd have carbohydrates, which would kick out insulin, and you'd want that because insulin, among the lesser-known attributes of insulin, is that it preserves muscle tissue. So, the theory was that, being on the ketogenic diet 5 days a week, you would maximize muscle growth and maximize fat oxidation or burning. And on weekends, you would have the carbohydrate replacement, which would maximize insulin release, which would preserve the muscle and prevent muscle loss. A frequent criticism of the ketogenic diet is that, a lot of registered dietitians talk about this, some of whom have never stepped foot in a gym. They talk about how if you don't have carbohydrates, you're going to lose a lot of muscle, which is complete bullshit. This is coming from a guy I've trained for 58 years, and I'll talk about my experience with a ketogenic diet later on. But to say that, going on a keto or a low-carb or ketogenic diet will cause a tremendous loss of muscle is just not true. The only way that will happen is if you, for some reason, curtail your protein down to nothing. And it is true, you can't have huge amounts of protein on a ketogenic diet because the excess protein will be turned in the liver into glucose in a process called, what's it called, the gluconeogenesis. It'll convert some of the amino acids to glucose, which will pull you out of ketosis, which is the production of ketones by the liver. So, but I'll talk about that in a minute. But anyway, let's talk about some of the benefits. A 2008 study found that in the short-term, high-protein, low-carbohydrate ketogenic diets reduce hunger. That's one of the great advantages. Speaking personally, I tried many, many diets when I competed in bodybuilding. Honestly, I couldn't stand them. The high-carb, low-fat diet, I was starving on that diet. I just couldn't take it. I didn't realize till years later I always had problems with insulin. And of course, when you eat a lot of carbohydrates, you stimulate of insulin. Insulin, in some cases, will lower your blood glucose and stimulate hunger. That's what happened with me. I couldn't stay on the low fat, high carb diets. I experimented and finally came upon the low carb diets, and I started using them, and they were very, very successful for me. I lost all my body fat. I wasn't on any drugs, no steroids. I kept most of my muscle because I continued to consume a high protein diet. I'll talk about that a little later in the video, but getting back to the study, it found that high protein, low carbohydrate ketogenic diets reduce hunger and lower food intake significantly more than high protein, medium carbohydrate, non-ketogenic diets. In other words, ketones seem to have a suppressing effect on appetite, making it easier to stay on the diet. Dieting compliance is the most important aspect of any diet, because if you can't stay on a diet, no matter what kind of diet it is, it's not going to work for you. You have to choose the type of diet which you could stay on for an extended period of time to get results. In my case, it was a low carbohydrate ketogenic diet. I started out with a ketogenic diet, and then I gradually added carbs. The way I did it, first 5 weeks or 6 weeks, I started with a ketogenic diet, which, very rapid fat loss when I did that. I wasn't even doing aerobics in those days, just from going on the ketogenic diet. I started to notice results after about 3 or 4 weeks. And after that, I only stayed on it like 2 weeks after that, but the fat loss was coming off like I was having liposuction. Almost daily, I could see fat loss almost every day. And then, when fat started to come down, I switched to a low carbohydrate diet, which really wasn't that much carbohydrates. I only ate, I went from 20, with the ketogenic diet, I consumed anywhere from 25 to 0 grams of carbohydrate. Again, I had, that's right, 25 to 0 grams of carbohydrate. And of course, on weekends, I did increase the carbohydrate. When I went on a low carbohydrate diet, I increased the carb intake from 60 to 100 grams. I found that if I went over 150 grams of carbohydrates a day, the fat loss would stop. Even with the calorie adjustments, I didn't get fatter. The rapid fat loss would just cease if I went over 150 grams. Some people can eat a lot more carbs. I couldn't, because I've always had, like I said, I have genetics for diabetes. I've always had some aberrations in the way my body handles insulin, so I'm more sensitive to carbohydrate than most people, so I had to have carbohydrate limitations. The use of ketogenic diets in sports and exercise remain controversial because carbohydrates are always considered the best fuel for such activities. Basically, I would kind of agree with that. If you're engaged in extended endurance activities, such as ultra marathons, which is 26 miles, 385 yards, or those 100-mile runs, or something like that, extended endurance, carbohydrates are the way to go. There are some authorities who are now recommending that you kind of mix, start out with, use a low carbohydrate diet to get your body to maximize the use of and store glycogen. There's a technique where you start out with low carbs, and then you add carbs gradually back. This is for endurance stuff. It seems to be useful, but generally speaking, carbohydrates are better utilized for long distance endurance work. For weight training, it's a different story. Despite this, some studies have found that a ketogenic diet can increase muscular endurance. It does that by forcing the body to use fat as a major fuel source rather than carbohydrates. Remember, a gram of fat has 9 calories per gram. A gram of carbohydrates has 4 calories per gram. If you can utilize fat, you get more bang for the buck. However, it does take longer to utilize fat as a source of energy compared to carbs. Carbs are rapidly utilized as a source of energy, whereas fat's a little bit more complex. But if you can kind of dip into your fat stores, they can actually, because everybody carries a certain amount of fat. It's a tremendous energy source if you can tap into it. It also seems when you go on the ketogenic diet, it also seems to promote the development of new mitochondria. Mitochondria are cigar-shaped organelles in the cells where fat is oxidized and energy is produced as ATP. And the more mitochondria you have, the more muscle endurance you have. So by restricting carbohydrate, you stimulate the development of new mitochondria, which in turn means increased fat oxidation ability. For example, a study in 39 athletes noted that being in a metabolic state of ketosis improved physical endurance due to the body's ability to use fat as an alternative source of energy. The 2016 study, which was published in the journal Cell Metabolism, found, this is what the conclusion, I'm reading directly from the study, the conclusion found that ketosis increased intramuscular triglyceride, that's fat, triglyceride oxidation during exercise, even in the presence of normal muscle glycogen, co-ingested carbohydrate, and elevated insulin. Now that's surprising because normally when you have, when you take in carbohydrates or have full glycogen stores, your body doesn't burn as much fat. But apparently when you go into a state of ketosis, it makes no difference. You're still going to burn more fat. That's amazing information. I mean, there was an initial study years ago. I can't remember the author's name, but anyway, these guys used cyclists, and they found that the cyclists were able to cycle much longer, and also they burned like 2.5 times more fat on a ketogenic diet than other cyclists who consume carbohydrates. Continuing with this study, it says these findings may hold clues to greater human potential and a better understanding of fuel metabolism in health and disease. A 2018 study published in the journal Metabolism featured 20 endurance athletes and had similar findings, reporting that following a ketogenic diet for 12 weeks improved performance, body composition, and fat burning during exercise. Still another study published in the journal Current Sports Medicine Reports in 2018 found that ingesting ketone supplements increased muscle recovery following training and also reduced protein breakdown, which would mean it spares muscle protein and prevents the loss of muscle. On the other hand, a well-publicized 2017 study of race walkers found decreased endurance in the racers who consumed the ketogenic diet compared to those who consumed the higher carb diet. But people pointed that out. They said, well, here's proof that carbohydrates are better. But what they didn't mention was the same study showed that the athletes who consumed the ketogenic diet burned far more fat compared to the athletes who consume more carbs. So I guess it depends on what you're looking for. If you're looking for exercise performance in a long distance race, you go with carbs. If you want greater fat oxidation, you go with less carbs. That's the way it works, basically. A 2019 study of CrossFit athletes showed that consuming a ketogenic diet burned more fat compared to higher carb diets, but it seemed to work better in men than women. Nobody really knows why that's so. And it's kind of interesting because women generally, because of higher estrogen levels, tend to actually oxidize more fat than men when they exercise. So this was kind of a curious study. I can't explain it. Other studies involving both humans and animals found increased workout recovery in those who consumed the ketogenic diet. One notable problem with ketogenic diets is that it takes at least 5 to 7 weeks, as I said earlier, for the body to accommodate to using primarily stored fat and ketones rather than carbs. During that time, feelings of fatigue and weakness will be greater. This is often called the keto flu. And I wrote an article in my Applied Metabolic Diet, my Applied Metabolics newsletter. I wrote an article on explaining what causes the keto flu and exactly how to overcome it. It's a very extensive article. Subscribers can find it in the article archive, and of course you can subscribe to my Applied Metabolics newsletter. You'll find that article. It's a fantastic article for anyone who wants to go on a ketogenic diet, because by following the concepts that I outline in this article, you'll avoid almost all the problems that most people experience in relation to fatigue and training energy when they go on a ketogenic diet. I wish I would have known this when I competed as a bodybuilder, because I did have some energy problems when I initially started the diet, but I didn't know this back then. Anyway, as I said, the keto flu is caused mostly by a drop in sodium levels, because ketogenic diets provide a natural diuretic effect that causes the body to eliminate sodium. However, if the sodium is replaced by consuming about 2 grams a day of sodium, the fatigue will subside. Also useful are potassium and magnesium, which are both lost when you go on ketogenic diets, again, due to the diuretic effect. They're kind of swept out of the body when you lose water. So, if you throw in those electrolytes, potassium, magnesium, you'll feel a lot better. That's one of the keys to overcoming the keto flu effect. Some have criticized the ketogenic diet, claiming that it promotes muscle loss. However, this is related to a reduction in protein intake. A lot of people who go on ketogenic diets especially people that are working out with weights, they tend to go too low on the protein intake. And if you go too low, you will lose muscle on a ketogenic diet. There's no question about it, because you're not taking in carbohydrates, you're not taking enough protein to support the muscle, so you will lose muscle. What they found in studies and for practical experience, you don't want to have too much protein, because too much protein, the excess amino acids will be converted into glucose in the liver, as I said earlier, through gluconeogenesis. So what you want to do is aim for about 1.6 grams of protein per kilogram of body weight. That's enough to keep you in ketosis, also enough to maintain your muscle mass while you're on a ketogenic diet. And that also will maintain another problem with ketogenic diets, is that if you go too low on protein and calories, you're going to your IGF-1, insulin-like growth factor 1 levels are going to drop like a rock. Insulin, like IGF-1, is a anabolic hormone, particularly the intramuscular form. It's heavily involved in the muscle growth process. You want to maintain that, and you do that by ingesting sufficient protein. Although your calories will probably be down on a ketogenic diet, if you keep the protein up to the level I just said, you shouldn't have any problem with IGF-1. As a matter of fact, one of the people that go on calorie restriction diets to increase the longevity, one of the problems is that they're eating enough protein to maintain IGF-1, which they don't consider a good thing, because some scientists consider IGF-1 to be an anti-longevity hormone, in the sense that it seems to promote cancer and aging of tissue, some tissues. On the other hand, it also maintains neural tissue, heart tissue, and connective tissue. So, it's a case of the devil in the deep blue sea. I mean, if your IGF-1 gets really low, you might live longer, but you're going to look and feel like shit. So, I mean, you're not going to be able to walk. Your muscles will be gone. You're going to be like one of these typical old people. You'll be like 90 years old, but, you can't move. You're walking like that. I mean, I'd rather have a little I'd rather live a little bit shorter, but live a quality life. But that's just me. Anyway, that's about it. So, all in all, I would say, however, in case you're wondering, I don't think you should stay on a ketogenic. Some people, there's a couple of people that not necessarily bodybuilders. There was one guy who wrote an ebook that I looked at. He had severe diabetes, so on all kinds of medication. He decided to go on a ketogenic diet. It completely cured his diabetes. He lost a lot of body fat, and he thought it was so good, he's decided to stay on it permanently. So this guy stays on a ketogenic diet year round. I don't recommend that for anyone wanting to build muscle, because I don't think the ketogenic diet is the best diet to build muscle on. It's great for fat loss. I think it's good as a temporary measure, especially if you want fairly rapid fat loss. It's the best diet, as Dan Duchesne and Mario Di Crisquel pointed out, and I still believe this. And I'll argue this with anyone, the so-called pundits who say it's no good and it has no no superiority over high carb diets. I say bullshit. I've tried all the diets, and I've known hundreds of people who've used various diets. No diet will cause as much fat loss in as little a time as a ketogenic or low carbohydrate diet. Don't believe these so-called ivory tower scientists. They're full of crap. Most of them don't even ever go into a gym. I'm sorry. I don't buy that. I go by practical experience and what I see, as well as what's in the biochemistry book. So again, ketogenic diet, good for short term, fat loss, not good to stay on all year round. You could stay on a modified low carb diet, which is basically what I do. I do it because to control fat, body fat, and also because I'm pre-diabetic. And I found I'm even more sensitive to carbs now at my age than I was when I was younger. I mean, if I eat even an average amount of carbohydrates a day, I check my glucose with a glucometer in the morning, and I'm almost up to diabetic levels. My body simply cannot tolerate, and I exercise. I exercise. It's not like I'm sedentary. So my body is super sensitive to carbohydrates. As a result, I have to limit my carbohydrates. So I stay on a kind of modified carbohydrate. What I do is try and get most of my carbohydrates in, and I do eat carbohydrates, but I try to get most of it in when I'm most active, like before my workout, and maybe a little bit right after my workout. But later on, when I'm less active, I concentrate on just proteins and have very little carbohydrate. This is what I've been doing for years, and it seems to work because I don't have diabetes. My father died of diabetes, diabetic complications, when he was only 2 years older than I am now. So I'm trying to avoid that. And again, I don't care what any of these pseudo experts say. I really strongly believe that if you have any tendency to diabetes, a low carbohydrate or a controlled carbohydrate intake is by far the best way to go. A person with, let's say, who's insulin insensitive, who has genetic tendency towards diabetes like me, it's on both sides of my family. For me to consume large amounts of carbohydrates would be akin to pouring oil on a fire. It's absolutely ridiculous. It makes no sense at all. And yet many experts are telling people with diabetes, oh, you should have a low-fat, high-carb diet. That's the stupidest advice I've ever seen. That is completely ridiculous. These people are already hyperinsulinemic. In other words, they already secrete too much insulin. And a high-carbohydrate, low-fat diet is poison for such people. I don't care what any of these guys say. I don't care how many freaking degrees they have. And, they're not living in the real world. So that's about it. If you want the best and most in-depth information about nutrition, everything about nutrition, which food supplements work, which ones don't, hormonal therapy, anti-aging research you can use today, fat loss techniques that really work, ergogenic aids that will help you work out harder, what else? Exercise science, women's health and fitness, and many other topics. My publication, Applied Metabolics, is the only publication I know of that covers all of those. There are other digital publications that cover nutrition quite well. And there are other publications that cover exercise science very, very admirably. They cover it well, but none of them covers as many subjects as I do. And none of them has the length or the breadth of experience that I do, which is now it's 58 years of practical experience in the gym and study. I can't think of anybody who publishes a digital publication related to health and fitness who can match that record. I don't care how many PhDs they have to their name. They can't match my experience and what I've learned. And I pass this all on in my Applied Metabolics newsletter. So subscribe today, www.appliedmetabolics.com. When you subscribe, I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information on nutrition, exercise science, medicine, and health topics. Very interesting stuff. Very interesting, if I say so myself. That's only for current subscribers to Applied Metabolics. Also, I have an email portal on my Applied Metabolics site. Again, current subscribers only are welcome to submit questions about either anything I wrote in Applied Metabolics or any short questions in general. I will respond only to current subscribers. I don't respond to unsolicited inquiries because my subscribers come first. You're welcome to leave comments under these videos especially comments about topics you want me to cover in future videos. So You can leave questions if you want. I can't guarantee. In fact, I'm having less and less time to answer these questions. So don't count on me answering questions that are left under the videos. Anyone else is welcome to answer, but I don't know if I can. My subscribers, as I say, come first. So that's it. Take care. And if you saw Bruno at the beginning of the video. If you want to have the best friend you'll ever have, you go to your local shelter, adopt a dog. They're the best. They're the greatest. I love them. I wish I could rescue every one of them on earth. They're to me, they're God's gift to humans. The word dogs, check it out. What's the word dog spelled backward? I won't tell you what it is. Figure it out. Take care.